Rasika Joshi with us, who's an oral pathologist who's working at Dr. Agarkar's clinic. So Doctor, you being an oral pathologist, you can educate more about what oral cancer is. And generally there's a myth that only tobacco users can develop oral cancer. So can you enlighten more on this factor?
Sure. So me being an oral pathologist, early detection of oral cancer is very close to my heart. Because as a pathologist, I have seen cases under the microscope in histologic sections wherein not only oral cancers but also other odontogenic tumors or salivary gland tumors which come to us at a very advanced stage. So it is very important that early detection, that is like prevention is better than cure. So early detection is the need of the hour to reduce the increasing oral cancer cases in India. And as you rightly said, there is a misconception among the general population that oral cancer is seen only in tobacco users or poor people or who are not keeping the oral hygiene properly. But that's not true. There are many other causes of oral cancer, some being alcohol, chronic irritation or chronic inflammation, genetic instability nowadays, and inheritance, or even something as simple as a sharp tooth or a sharp denture which is causing constant irritation in the soft tissues of the oral cavity. So it's very important for everybody to know that along with teeth, getting your oral cavity in general, that is a comprehensive oral screening which would include the teeth as well as the soft tissues, is very important.
What do you think, how will well scan help detect or prevent this?
Yes. So well scan is a very compact advanced device, and as Dr. Sanket also said, that it is very handy, it is very safe for the patients, and the patient compliance is very good because it is a non-invasive test. Only under a safe blue light we can see abnormalities in the oral cavity. So yes, it is very useful to detect. Sometimes even the symptoms are not yet seen or understood by the patients, but the dentist can detect those with the help of this light. So yes, it is very handy and very useful.
After Wellscope examination, if there's any abnormality detected, can you tell us in a very simple language, how will you explain the patient to go for a DNA Ploidy test, and that how a DNA Ploidy test is different from any other test in the market?
Right. So if there is loss of fluorescence that is detected under the well scan, so we know the exact area where the abnormality is, and with that light we can take a simple brush sample from the patient, which is painless without causing any discomfort to the patient. We can collect the sample and send it for something called as a DNA Ploidy test. Now this test has been developed by the British Columbia Cancer Agency, and it has been used worldwide. However, in India its acceptance has increased now, and so in that basically it uses artificial intelligence with the use of certain softwares. It is going to measure the quantity of the DNA within the cell. So this helps in a very early detection of any changes that can happen, and we can tell the patient that yes, you are at a higher risk of getting oral cancer, and accordingly the treatment plan can be proceeded. So the patient compliance with this is very good. They agree very easily for this test.
You've been using WellScan for a very short period, and you've really got an interesting case recently. So would you like to throw some light on what the case was?
Yes. So we did a couple of Ploidy tests, and one of them came positive. So the patient was a tobacco user. So it was very useful in educating him. We could show him the real-time pictures which were captured, and we could educate him, we could motivate him to stop his habit. And at the same time, once the test came to us, it did show some changes, and that was explained to the patient, and then the biopsy is recommended. So although biopsy is the gold standard, but to convince the patient to undergo a test is very easy with the well scan. So yes, it really helped in motivating him.
Being a pathologist, how would you want to convey to the patients how they can stay fit and healthy, like preventive measures? Can you
Yeah.
like explain something on?
So the best way to prevent oral cancer is number one by staying away from tobacco, because it's a known causative agent. We know it that it is the risk factor, so it's best to stay away from that. Lead a very healthy lifestyle, and most important is getting comprehensive oral screenings done annually at during your dental checkups. And the good news is that these tests, this well scan test can be done, including the DNA ploidy test, can be done at chair side, on the dental chair itself. So please avail the benefit of this technology. I encourage all the patients to get themselves screened at your nearest dentist who has this facility. Also encourage all your family members to do the same. And this needs to go to ground level where we can really make a difference in reducing the number of cases of oral cancer.
Thank you so much for your experience. I'm sure everybody is going to go out there and visit a dentist for a well scan. Thank you so much.
Thank you.